All right, so being a lifeguard, one of the things that we talk about a lot is what we call head, neck, or spine injuries. Okay, so this is something that we got to pay attention to as a lifeguard because if somebody dives into shallow water, they have the potential of hitting their head, which could cause some sort of spine injury that could potentially cause paralyzation. So, in this next piece of video, we're going to talk about understanding what that is, what you have to do to kind of prevent those things, but also what do you do in the care phase of this? So, head, neck, and spine injuries are obviously one of the most dangerous injuries possible. The video will reference a little bit on concussions, which is obviously something that you guys are aware of, but it's more than that. It's just thinking about the whole system from head to toe. How do we make sure we care for the head, neck, and spine? So, let's take a look at this piece of video here.
Concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt to the head or body that results in rapid movement of the head. Many people who experience concussions do not lose consciousness, or they lose consciousness only briefly. A person who has experienced a concussion may have physical signs and symptoms, such as headache, blurred or double vision, sensitivity to light and noise, problems with balance, and nausea or vomiting. A concussion can also affect the person's ability to think and remember. For example, the person may have trouble following instructions or be unable to recall events that occurred immediately prior to or following the injury. You may notice changes in the person's mood, such as irritability, sadness, or anxiety. The person's behavior may also change. For example, the person may sleep more or less than usual. The effects of the concussion can last for several days, weeks, or longer, depending on the severity of the injury. If you think a person has a concussion, advise the person to stop the activity he or she was engaged in when the incident occurred. The person should follow up with a healthcare provider for a full evaluation if EMS has not been called. Giving the brain time to heal is essential for recovery, and the person's healthcare provider can best determine when it is safe for the person to return to normal activities.
All right, so this talks a lot about concussion, but one of the things I want to make sure you understand is if we talk about head, any sort of head injury, there's a few basic rules of first aid care. Number one, do not move the person. Okay, so if they're lying down, try not to move them. Obviously, if they're in the water, there's got to be some precautions. If you're at a pool, your lifeguard staff they're well trained in removing somebody from the water. But if it's a buddy of yours and you're at a lake or something, you got to get them so they can breathe, but you can't move them very much. You can't ask them to walk. You can't try to carry them across, any area. So most important thing is that you just keep that in line, kind of stabilized. So essentially what you'll do is you'll take the head and just kind of hold it in place like this, making sure not to move it from right to left. You can do this in a car accident situation. You can do it in a just any sort of injury place. Somebody falls off a four-wheeler, they're feeling a little numb in their feet, toes, legs, arms, those kind of things. All you do is hold and get 911 on board as fast as you possibly can. Okay, so that's thinking about head, neck, and spine. Super, super important. And obviously we are in a society where we take chances, especially as young people. So this is something that could be really dangerous if you are not careful. So thanks, guys.